right, good morning, everybody. I will give maybe one more minute for people to relocate to the other rooms. All right, I think we're almost there. Well, good morning, everyone. My name is Nienke Schutte, and together with my co-host, Milana Trukle, we will be hosting this panel for you this morning. We are both working at Sciensano, the Belgian Public Health Institute, Research Institute, working at the Data Governance Scientific Directorate there. Let's start light. Imagine a moment 7 years from now, from today. We are at the offices of a health data access body. It's Monday morning, the coffee still tastes as bad as it does today. And on the desk of, digital health portal, there are dozens of new data access applications from research institutes, from companies who try to design AI as medical device. Some involve very complex cross-border data sets. Others try to combine or link data from genomic sources, registries, electronic health records, etc. And all require careful legal and risk assessments. And every single one of them needs a decision that is consistent, transparent, and legally sound. And if that scenario sounds slightly stressful, then imagine the next day it's Tuesday. And that is the reality of the European health data space. That is the reality we're moving toward. And for several years, the European health data space has been more of a policy discussion. We've been discussing governance frameworks, infrastructures, the list that Marcella has presented this morning. We debated principles, data sharing, safeguards, rights, entering now the operational phase. Member states are preparing their systems, their pipelines, new institutions are being created, and soon the health data access bodies will begin to receive a large number of data access applications. And these health data access bodies, they do actually not assess the scientific quality or provide ethical approval. No, their task is different, but equally demanding. They must determine whether a request is lawful, whether the risks are acceptable, and whether the safeguards are sufficient. Doing that consistently will not be an easy task, and manual processes alone are not really likely to scale. And this all raises very important questions. What role could perhaps artificial intelligence, AI, play in this matter? Maybe as a filter, triaging the applications, detect missing information, maybe do some legal cross-checks or highlight risks that deserve some closer attention? Or can we be more ambitious? AI as a co-analyzer, supporting reviewers as they assess complex regulatory frameworks, compare cases with previous decisions, or deal with the ever-evolving legal framework and landscape. The moment that we introduce AI to these public decision-makings and governance processes, questions emerge. How do we design these tools responsibly? Can we? How do we ensure meaningful oversight? Can we make AI-supported assessments? Can we make them explainable, accountable? And how can we maintain trust when these automated systems actually really become part of public decision-making? These are the questions we will explore with the experts in our panel today. Because we need a European health data space that is efficient, an efficient governance system, but also trustworthy, transparent, and ethically aligned. Let me give the floor to my co-host, Milana, who will introduce the panelists. And actually, Mr. Marcella already called it a diverse set of stakeholders that we need. Well, they're here on stage. With whom we will explore how and if responsible AI can support the health data access bodies, and what it will look like in 7 years. Milana.
Is this on? Yes, perfect. Thank you very much, Nienke, for setting the scene and for the kind introduction. We will now turn the attention to our panelists. First of all, thank you very much for being here with us today and for sharing your expertise. I have an introductory question for each one of you. We should aim to be around 5 minutes maximum. And then we will have a second round of questions, which will look a bit more into depth in some of the topics that Ninke mentioned. And then, of course, we haven't forgotten about the audience, so we'll also have 15, 20 minutes for the audience. So if anything pops up in your mind while the speakers are talking, note it down, and we'll have time for that as well. And we will close the panel at 11:15 sharp. I will start with Audrey. Audrey Van Scharen, who currently serves as Manager of Ethics at the University Hospital Brussels. Welcome, Audrey. So our question is, as the Ethics Manager, you're used to evaluating research involving health data. So could you please briefly outline the key ethical issues that such committees typically consider, and how the growing use of AI in decision about data access and reuse might shape or even maybe complicate those considerations?
Yeah, thank you, and thank you for inviting me. I've been a member of the Ethics Committee reviewing research for 10 years, and recently I was at a presentation of Pharma.be, and there was somebody from the government saying, we all hate ethics committees. And I get it, because we are often perceived as being very bureaucratic and hindering research and being an extra hurdle. Sorry. But people tend to forget why we were actually created. We were created following atrocities in research to be the person protecting the patient, the body that would look at the patient's rights, respecting human rights, following Nuremberg, and then there were all kinds of codes of conduct. Now the Helsinki Code, ending up in the Helsinki Code, still applicable today. But those codes were not enough, because even if those codes existed, there were still misconduct after, for instance, published in Beecher's Bombshell. And those reflections actually led to the fact that relying solely on a researcher's virtue, that they would do the right thing with patients, it's not always enough, because you're just one person and you have an aim, you have a scientific aim, you want to prove it. I'm not saying that all researchers are evil Dr. Mengeles, don't understand me like that. But it was reflected that you need a body, a multidisciplinary body, looking at what is going to happen from different angles, different perspectives, and this takes time. It takes time to organize it. It takes time for all those people to look at it, and that's where often people waiting for access to their data are getting nervous. If it's, for instance, now through the ethics committee, because now we are the ones reviewing it. However, if I look at the main questions we have, and Paul, for instance, is also a member of our ethics committee, Professor Quinn. The main questions that are asked is, where will you keep the data? How long will you keep it? What is your legal basis, and so on? And those are things that are quite compliance. And so, since the Nuremberg Code and the Code of Helsinki the first time, there has come a lot of legislation that we also have to apply next to the ethics reflection. And that's where I think that AI can be very useful. Having some kind of compliance pre-check, because we, as ethics committees, have become compliance bodies more than an ethics reflective system. Because we do not have time, because we have to look at all the legal things, and then you have 20 files on one meeting, so there's not a lot of time to discuss on the deeper ethics. But I do want to point out that there still is an ethics reflection necessary, because we are now looking at a new legislation in Belgium for scientific research, medical scientific research. And there explicitly is the discussion, take out everything, every research that is based on pre-existing, solely on pre-existing data. They don't have to go to an ethics committee. They will go to some other body, if it exists, but there's no legal obligation that it exists, like a HELT, like a data access body or something in the hospital. But there we really emphasize it's not solely about cybersecurity and where you will store it. There is still an ethics question, whether this data use is proportionate, whether the autonomy is respected, and if not, because if this is justifiable, and this has to be looked at by different backgrounds. Because often people say, yeah, but it's only on data. It's not an interventional study with a medical device or with IMP products. You know, but it's still a person at the end, and people tend to forget.
Thank you very much. Justin, we'll move to you. You are a computer science engineer and team lead of engineering and AI at the Belgian Health Data Agency. In your role, as also what I just explained about you, says you work on the engineering of and AI side of the systems that support health data access. So with health data access bodies expecting a surge in cross-border applications under the EHDS, where do you see AI most effectively supporting such operations in managing growing volume, but also the complexity of such requests?
Thank you. Yeah, I'm actually happy to hear from Audrey that it's the completeness check that are a bit of a hassle. In the EHDS, here we are talking about data access applications. I think it's maybe something important to highlight that they differ between data requests and data access applications. So data requests when you ask for statistical aggregated data, and data access applications when you ask for individual level data, you know, very granular. Data requests actually, although it's not the topic of today's debates, are one of the two that could really benefit from technical solutions. If you look maybe in the Nordics, there are federated systems where if you are an authorized participant, you can just log onto the platform and then just query the database, the data sources in a federated way. And then there are some business rules to check that the queries and the results do not leak any sensitive data. Because although it's statistical aggregated results, it might still contain personal data. And that's actually what we are also working towards with the new registry policy in Belgium. But maybe let's focus on data access applications. So data access applications, as an HTAP, you have 3 months to give an answer, extendable by another 3 months if the use case is particularly complex. And that's what we're trying to kind of reach in the shortest amount of time. So now that the context is a bit laid down, I had the opportunity to discuss with the colleagues this week on how we would see it implemented in our system. And we've identified really 2 use cases for an AI system. Most likely, I say AI, but it's most likely like an agentic system based on large language models. The first one would be to really help the user reach the perfect application. So to make sure that this application, give me a second. Yes, this application is complete, right? What we want to avoid are the back and forth communication at the start of the application. And maybe not talking about AI, there are 2 ways that are now being worked on to solve that. The first one is providing the user with extensive metadata, right? I think Ninke, you will agree, right? There is a health data pay, a metadata standard, and dataset descriptions are mandatory for data holders. So you start your application from a data catalog where you already have information about the dataset. The other one is a complete application form. It's very important, right, that you capture all the information from the get-go. There is also an EU application form, which is quite long. It's like 10 sections with sometimes 15 questions in one section. But still, you have these two tools that are going to be used to make sure that you capture as many and as much information from the start, but still you might end up with missing information, right? And that's where an AI system could really help the user to reach that perfect application where you have an agentic system that has, you know, information like the legislation in mind, previous applications, and also where the user could import their own documents to populate the application. And this can happen before the application is submitted, so the user could like create a mock-up application, upload, as I said, their documents so that it populates the whole application, and then kind of already receive a feedback based on previous application. We think that you might need to improve this or this or this. It can also happen after the application is submitted. So on our side, on HDAB side, we would have a system that kind of does those completeness check before any real assessment is performed, and really to try to tackle that first exchanges with the user. Or it can actually be both. You know, in Belgium, we have a small cell risk analysis that is performed when you want to have access to data. This, if you have sufficient metadata, this could also be performed at the earliest stages. So the second use case is when the application is already that perfect application, right? So you have a perfect application, you have all the information that have been submitted, and now you need to assess it. So we need to perform several assessments, ethical, legal, check the data flows, etc. And here, again, if you think about agentic AI, you can maybe take a bit of inspiration from some coding models and imagine an agent that has a certain set of skills, right? So such as like he's a legal expert agent and kind of perform some assessments and give recommendations for you. But now I guess the question is, where does it end, right? So you have an AI model that performs these assessments, provides recommendation. Where does the human now, who takes the decision? I think that's what we're going to explore today.
Perfect, thank you very much. I think this is a very good connection to Martina. Martina Fonseca, Chief Data Officer at Sciensano. As a research institute, Sciensano regularly submits applications to access HELT data, giving, therefore, you a clear view of the permitting process from the applicant side. What are the main pain points you currently experience in this process, and what improvements in predictability and transparency would you expect or need from AI-supported permitting systems?
Yes, thanks, Milana. So Sciensano, as a scientific public health institute, conducts a lot of activities related to monitoring, surveillance, research, and policy advice. And for all of those, really, data sits at the center, whether we're talking the collection, the quality and validation, the analysis, or dissemination. So we're both data holder, so for instance, regarding the epidemiological landscape and monitoring and surveillance, but we also need data from others in the ecosystem to conduct those activities. And that can come from different sources. It can come from the Belgian regions, it can come from labs or hospitals, or other stakeholders at a more national level. Say we need something on determinants of health, we might go to Stadbel or statistical office to obtain that. Now, if you're a researcher, even if you're a bit in the know in the process, let alone if you're, say, a new PhD student that has 3 years and needs to, you know, try and link data from prescriptions, from social determinants, from the wider health status. It's currently in the pre-EHDS, there's different routes to do that. The application forms look different, the fields asked For some, it's an email. The person receiving might be different, a statistician, an archivist, a data steward or curator. And then the internal processes in the organization might vary. And also the way that you receive the data. Now, there are some commonalities, obviously, GDPR, the Register of Processing Activities, the DPIA. In Belgium, we also have the Information Security Committee if you need, in some ways, indirectly to, if you need to link the data. But the truth is that it's a very disparate process. Even if the first step of the process, which is the discovery, is ideal, and you say, I know exactly what data set I need, I know exactly which data holder has it, and I know all the nitty-gritty of the issues with the data set. So that being said, for the researchers, I think the EHDS is very good news, because we're talking about a harmonized user journey, and maybe taking this point on the predictability and transparency, that's not at the level of the AI systems, but in general should lend it to be more of a predictable and transparent process. Now, it's one thing to be useful on paper, and obviously it's not just on paper, as we heard. We all have the implementing acts, we have the pilots, and we have amazing work being done by different stakeholders. But it also needs to be, like a bit Justin was alluding to, usable, user-friendly, so that the systems we put in place really help the user. So that at the end, we really reap the benefits that we want, so the right research outputs, the outcomes in eventually better health and prosperity. So the reason I mention this is, indeed, we could see it AI in two forms. Partly, you could see it as indeed helping this process of the transparency, if you'd see it helping the user. So there'll be different levels of literacy in submitting applications. And so ensuring that everyone has like a right ground to start with. So that indeed could go from helping them with the completeness. You could imagine that HDABs would tag on the quality of submissions, not the research quality, but indeed how complete the answers are, or you could even see it recommending similar applications for similar research questions to make it easier to say, okay, this was submitted, was high quality, was approved, okay, this is the benchmark. I think the same at the level a bit of the triage. You could consider that some requests will be a lot more complex than others, so you could, in the HDAB, use that to help triage to more senior or junior. And then closer at the level of the permitting, I don't think we would see as researchers like giving ever that responsibility to an AI system. So even if you have safeguards of human in the loop, human accountability, but there's aspects where we know it's not like the interpretation of sometimes what's public interest, the weighing of the level of minimization. There you could try and see through the large corpus of applications that will appear in transparency portals, try to ensure, okay, what was decided in the past so that the right stakeholders can use that. And in that, large language models and others can really be powerful to do that. And maybe that, just to finish up, obviously, anywhere where we do use those systems, ensure that we have the right documentation, that we've done the right risk classification, and that we've applied in their prototyping, deployment, and eventual recalibration, all the trustworthy AI principles to ensure that it's well governed.
Thank you very much, Martina. Tom, we will move to you. Tom Leenaert, a professor in the computer science department at the Université Libre de Bruxelles, ULB, and academic director of FARI, the AI for Common Good Institute. Would you briefly share with us the types of AI systems you study, and then your perspective on the realistic possibilities and limits of using AI to support decision-making processes like data permit reviews?
Thank you for the Can you hear me? Yes, thank you for the invitation. So just in answer to your first part of the question, I'm doing too many things, so I don't have enough time to summarize all the stuff I'm doing. But in general, what we're focusing on in my group are mostly two questions about how to build agent-based systems and how we can derive collective intelligence from this kind of agent-based systems on the one hand. But I guess the work I'm doing more on the predictive side in the context of rare diseases and health is more relevant for the current discussion, where we, for instance, look at methodologies to say, okay, looking at a patient's genetic data, what could potentially be the culprit of a particular kind of disease in case of that patient. But it can go as far as saying, okay, given what we know about patients and about this disease, can we maybe recommend drugs or novel compounds to actually treat particular kind of diseases? So this is very broadly stuff that I'm doing. Now, in relation to the topic of the panel, so I have so many things to say, but I'm going to try to focus. So what I would like to say is that the question of treating documents by AI is already 70 years old. So the hype of agentic systems and large language models, it's a new way of looking at this kind of things, but this has been going on for the last 70 years. So essentially, you have to look at domains like information retrieval, information processing, knowledge representations, and the new layer of language model is just another layer on top of this kind of things. So essentially, for me, this means that I can still look at what is historically been done in terms of research and see how I can apply this to treat this question of how to process this kind of data access applications. And I really want to jump on something one of my colleagues said here. We might help people filling in their form. I will bet money on this, that from now in 1 year, if you give these forms, they'll be totally filled in by AI. So people will no longer fill them in themselves. So this is the problem with any kind of form or documents, things that you would like to do. These systems are going to be trained to fill in those forms. I mean, if you look at European applications for grants, for projects, 2/3 of the questions are just blah, blah, blah questions and nothing to do with the science that actually you want to do. So what do? You ask systems to fill it in for you. They know how to please the person that actually reviews the documents, and you're done with that kind of task. So already there, you're going to have maybe systems filling in the documents and then system reviewing the system filled in by AI. So this is something that you really maybe should think about in the future, like, okay, you want to introduce processes that are legally compliant and everything like that, but legalese is easy to learn by these AI systems. So this is very important to think about. And I think what is very important also, then people do this because they want to have a simple process. If I do my research on data, I want to send a message today and I want to have an answer tomorrow because the speed of my research is like that. All right? So this is, I think, very important to understand. And of course, then the system that treat the consent applications will, if they're AI-based, they'll probably be faster than if a human has to check this. But again, I'm probably going to discuss this, the questions of transparency of this decision, how actually decides, explaining why it says, okay, this one is we will accept, this one will not accept. These are all active research questions in the AI field where techniques are being developed that actually allow you to do these kind of things. And we can discuss further later.
Thank you very much. I think this very nicely connects to what we would like to ask Ildiko. Ildiko Weida, Senior Policy Advisor at the Dutch Patient Federation, who brings an important patient perspective to this discussion. So from everything we heard now about the AI evaluating the access to data, to health data, are there any concerns among the public? And in your view, what would patients especially need to see in order to trust an AI-driven process for such decisions?
Yeah, thank you. Yeah. Thank you for inviting me as well. So I think trust is here the key word. And to build up trust, I think first of all, time is needed. When this new reality of health data for secondary use will be the reality, and the new reality is actually, certainly in the Netherlands, that your data will be available unless you opt out. And this is really something new, because as we all know, opting out for your data reuse is a weaker form of control. And in the Netherlands, there is kind of worry about that, and maybe also in other member states. What will happen with my data? Who will use it? Why they will use it? Will they earn a lot of money from my data? So this is a really critical mass there, asking these kind of questions. So time is needed, first of all, and then when we add AI on top of it for assessing these applications, then there will be people, and there are already people who are saying, well, we know what's AI always doing. AI is, making lives, breaking lives. And then, of course, I refer to the scandal of the child welfare. In 2021, the government has resigned because of that. A lot of lives were ruined, actually. Children were taken in foster care. Why? It was not so much the AI the AI was also wrongly coded and took the wrong labels, etc., for making risks profiles for people that would be fraudulent activities. But what they did is, what actually was the case is that there was a huge automation bias. So people overly relied on the outcomes of these machines or these models. And there is really a kind of societal fear, or a collective fear, if you want, for that. So there we need transparency, or why is AI used, where in the process, where is the human in there? Because with that scandal, even the legal apparatus was completely lost, and that was really a big thing. And of course, safeguards. Technical safeguards, but also organizational, behavioral safeguards. And human in the loop or on the loop, I think we can also discuss that in a moment. So people would like to know if AI is used, why, and maybe just to mention at last that there is an algorithm register now in the Netherlands for all algorithms, all AI models that are being used by municipalities, townships, etc. And there, as a citizen, you can go there and you can check where is AI used and why is it used. So you can challenge it. You can ask questions. You can even call someone to ask and, well, to explain. So I think all these elements will be needed for the new status quo, new health data reality.
Thank you very much. I will pass the floor to Nienke for the second round of questions.
Yes, thank you, panel, for your interesting insights. I think indeed we have a diverse set of stakeholders here on board. So let's maybe dive a bit more into the data permit workflow. So we've heard that this workflow consists of several parts. I've heard completeness checks, compliance recurrent checklists, legal things, legal cross-tracks, cybersecurity, and then Ildiko said, and I want to maybe hook on to this, where in the process? So if we look at the data permit workflow, some parts that make up the decision for a permit, maybe we can easily identify which are suitable for AI and which steps must remain fully human-led. Can we do this as easily? Can we easily pinpoint these parts? And I would maybe like to see with the speakers here that are close to me, to see maybe from Audrey, are these very much intertwined, or can we indeed treat them separately? And then Tom, from the technical perspective, can we use AI for these different parts if we have identified them? Are they good enough to help us with this?
Yeah, thank you. So, to your question about whether the pre-checks or the completeness checks and the part that still has to be human are intertwined, yeah, in the current discussion it is, because at the ethics committee those questions are raised. When we think of some kind of completeness check or pre-check, those are things that would be very white and black. You filled in this part or you did not. Not is it right? You filled it in or you did not. You uploaded this document or you did not. And then, so this takes this, if you take this away, what are the discussions that are still human or that still need a human intervention or part? Well, for instance, we've been talking about a risk analyst that would happen. Who's going to decide on the leftover risk? It's not something that AI can do. Probably it can do it, but you would want AI to do that. So those are things that people still need to look at, because if you look at research with multimodal data that need to be linked, pseudonymizing even might be difficult because they have all different backgrounds, so if you would say, yeah, we have to put them there and link them then, and so this is this an acceptable risk linked to the research question? Is the research question and the fact that you would put the patient's data at, those are things that people need to look at. And in an ethics committee, there are patients. We have, for instance, in our ethics committee, 3 patients that can look at it, but everybody in an ethics committee is a human that has data, right? So we all think of it that way. So I do think that is a thing that will always remain. You will have to reflect on the proportionality of the data request. It will always be human, or needs to be human. And I think it's really crazy what you just said, that the forms will be filled in by AI and then evaluated by AI. True, wow. So yeah, yes. But for some legal things, I think it can be very useful that they at least take out some pre-check that we now lose a lot of time in, because investing in ethics committee time is not something the government is willing to do. So we do not have a lot of resources. They say, yeah, then it's really the government also that says, well, look into AI to help you for ethics committees. So yeah.
So my answer is yes. So maybe I can draw a parallel here. So the entire idea of having to process documents and then to say, okay, at this point, a human needs to intervene because something is fishy about this proposal or something needs to be checked in terms of ethics or legal aspects. So essentially, AI systems, I mean, in the 1980s, we had expert systems. I'm sorry, but the current large language models are just a novel form of expert systems, essentially. So they can do like they can validate certain things, like are there certain keywords missing there in terms of legal consequence. Like if you ask a person that fills in the form, what are your expected ethical implications of your research, or what are the legal consequences of your research, they can actually help in checking these kind of things. So that's fine. But so if you look for the link I want to make is with fraud detection, right? So banks and large organizations like that, they actually check your transactions continuously, right? And then they have to flag something is a fraud or something is not a fraud, and something needs to be checked there. And essentially, you could almost think about an ethical committee having the same issue, like, okay, certain things can be automatized. Certain things can be processed without too much verification because we have the systems in place to check all these kind of things. But it needs to flag at certain intervals or certain checkpoints in this kind of pipeline when a human intervention is needed, right? And then, of course, because this is a predictive system, there's a risk of errors, right? So let's stop speaking about hallucinations in the context of LLMs, they just make errors. And so the question becomes, what is the predictive error that you're going to allow if you are automatizing this kind of system? So this is again an ethical question for you, that you have to decide, okay, if we build this pipeline of automatizing all this kind of stuff, what is the risk? Is it 1%, 5%, 10% that you find acceptable? And this might depend on the kind of application that people, or kind of research or application people want to develop with the shared data in these health data spaces. But essentially, everything that we have been doing in computer science is about automatizing processing of data. And so AI is just the next level of processing this data. And we're going to make mistakes, but we're going to also do a lot of good things. And like the Dutch example was a horrendous mistake by the developers and the people using that system, because they could have checked for biases and they did not check for biases, right? And this I think, is the good thing about that example, that people got aware, and now engineers are also saying, but wait, I need to verify if my data is correctly balanced, that I don't have any biases in there that might lead to unexpected outcomes. So that actually is the good outcome of what happened there. Yeah. But of course, the people that actually were affected, that's very, very bad. That's also true. So it's possible.
I just want to, you go.
No, this is actually what you said. People are flagging, red flags are popping up, and people are just acting on those red flags. That is what I call, and what the assessment list of Trustworthy AI from the EU calls, human on the loop. Human in the loop is that you can't really go on to the next step without human approval. And that is, I think, we can talk about where in the process. And I completely agree with you, this assessment of whether it's proportional what you want to do with your research, whether did you think about data minimization, stuff like that. I wouldn't know how an AI agent, even trained on thousands and millions of examples, would do that. And should we allow that step? But then, of course, everything will slow down. And Ninka began with, there will be thousands and thousands of requests and how we will handle it. So it's
Yeah, I wanted to quickly touch upon the flagging also, because it's often suggested that ethics dossiers, submissions for data, for instance, are flagged, risks are flagged. And I think it's a very bad thing, because people will start relying on those reports and not even look at the submission anymore. So I would not go there anymore. And about the proportionate data, I had a point there and I lost it. Damn, I tried to move on. I had something I wanted to say. No, I forgot it. Bon, anyway, we'll come back.
But just to come back on the flagging thing, if you do not want to do flagging, you have to do everything like you're doing it now. So you have a choice. That's why I'm saying there's an error margin, and you need to decide what you find an acceptable error margin.
Yeah, I do agree. On the no, but you on the flagging, you can do it a missing document, but risk flagging in, this is an ethical issue and so on, that's something else, maybe. On document completeness, I am like, okay, fine. But on, this is a high-level risk on an ethical point of view, because they are not using, they're using opt-out, for instance, as this is something that I think, no, somebody should read the file, really. On the fastness, I thought it was very, you know how much time an ethics committee has now for giving access? I have to prove 28 days. Extendable if it's a multi-site, but not that long. And for a clinical trial, with the new Biotech Act, they want to go to 74 days for an approval. And of course, maybe it's not solely secondary use of data, but everybody tends to forget that in a clinical trial, they also reuse data. And of course, there is predicted, it's not only, so that's something I wanted to say also.
Yeah, thank you for raising this interesting point. So checking the flags, maybe then a question to the researcher here, Martina. As a researcher, especially when you're funded through public budgets, and you have limited amount of time, or you're a PhD student and you're expected to deliver a thesis within a few years, you actually would like to have a certain level of predictability when you submit a data access request. You really would like to know before what you can expect in level of predictability. Does this checking the flags, this is living up to your expectations when you're a researcher and submitting a data access request, a data access application, actually?
I think bluntly, no, because, I mean, at high level, as we said, the process looks really smooth, but if you have these checks that then don't have a meaning to them, or that block you, or then cause problems of oversight, that you become accustomed and just let something pass, and then further down the line it comes back. That doesn't also help the researcher, right? You could draw a parallel with a bit data quality. I mean, the earlier you catch the issue, preferably at the collection, the earlier you can solve it. The further you go in your analysis, then it's hard to explain the difference, to source it, let alone try to correct it. It's the same with these applications. If you have these checks that are not well thought out, it becomes a bit of a Kafkaesque machine, right? And so even though I talked about the benefits of automation, and I think there's a certain expectation that we do make use of the digital systems and the possibilities that that provides, I also think that researchers expect that there's some human element that remains. Because despite everything I said, usually now what happens is, yes, you might bounce around the system, yes, there might be different routes, but at some point you get to a human, even usually, okay, it could be a researcher, a statistician, that will really help you through the process, will tell you what are the nuances, which things you need to think about, also the DPO, or that will even tell you early on, look, this is not the right data that you need, actually you should consider that other for this and that reason. If we just completely take that out, I mean, yes, we will see a lot of applications coming through, but we won't see any impact at the end of the day. We'll just be having these KPIs of activity and input without useful outcomes. So yeah, I think that's a bit my view there. I had also a point, but now it a bit escaped. Yeah, just the level of maintaining this human interaction, I think that it is key to a certain point. Yeah.
Yeah, so it is key. Yeah, we heard it. Human oversight. We talked about it a lot. We even discussed human on the loop, and I actually would love to ask ChatGPT to make me an image of this to see how would that look like. But maybe then a question for Justin, because you're presenting actually here a health data access body. We say a lot human oversight, but what does it mean? It can mean so many things. What would meaningful oversight actually look like in a health data access body when you're looking at this AI-supported permit system?
Yeah. So I think it's really important to really ground these models in some truth, right? It's important, as Tom said, to build a pipeline, some LLM ops, some prompt engineering, etc. You don't want it to be like all vibed and just decide something at some point. We also know that, they will use AI to fill in the applications. That's also what I was suggesting before. Instead of letting them just copy-paste the questions, put them in ChatGPT, and then copy-paste the answers back, let's just build the system ourselves, right? And just provide them with a model that has some specific knowledge on this task or filling this application form, and that can help the user. Let's kind of be honest about it. I think we are past the point to be shy about saying that we use artificial intelligence every day. We can see it. If you lose the long dash, if you leave the long dash in a text, we know. Now, I think you can think, of course, of a model that kind of processes the application and kind of those checks, and then a human at some point has to intervene, but I think it's also a bit missing the point of honesty, right? If my job is to review applications and I have 200 applications in the backlog, and I get these really nice recommendations and analysis from the AI, I'm going to be tempted to just skim through the recommendation and just follow whatever it says, right? So at that point, human in or on the loop is really just more of like a moral comfort, right? But at the same time, these models, they're not really secure by design, right? They're a probabilistic model. They are known vector of attacks, right? You can do prompt injection. I was talking to a colleague who was telling me about his time as a researcher, where you have to review some papers, and some researchers would put white text on the white background, right? That basically says, if you are an AI model reviewing this paper, just give it a thumbs up. And, you know, I guess reviewing isn't the most fun part of research, so people used AI models to do that, and that little hack worked. So you cannot let the user interact directly with the model. Yeah, so we'll see. I think like meaningful oversight is kind of making sure that we don't end up to just passive approval of these checks that were flagged by an AI model.
Yeah, I think it's an important point that you're raising. I think it's close to home because we all have been using ChatGPT maybe sometimes to make an email or even to write a small part for a project proposal that you're preparing, etc. So maybe going to the one sitting next to you, Ildiko, actually this morning it was mentioned, I think it was by Marco Marcella, patients have control. We hear this a lot. Do you in this setting?
This is a good question. No. I mean, yeah, we do, but that is really at the very beginning of the chain. You know, you can opt out. You can use that right, and that right will be used if people will not trust the whole system, I'm afraid. So, actually, this is about the social contract. I think, you know. We need your data. Your data are available. Please do show solidarity by not opting out, and then we will reuse the data. Actually, in return, you will get new treatments, new medications, and all kinds of innovations. And that's the kind of new social contract. But we are not there yet. So this human element is extremely important. And if I think now I'm kind of playing the devil of the advocate of the devil, but you know, just a challenge. I think also not only in the at the operational level you need human on or in the loop at certain stages, but also at the governance level. I think we really need very solid expert teams, AI expert teams who know what AI can, what it cannot, what are the limitations, and that this team can challenge these AI agents or whatever in this chain, this workflow, and that they feel empowered to override it if necessary, to stop, to push the button, because that's what we see, that you know, you go with the collective, this is this group pressure and efficiency, and if we optimize the whole system for efficiency only, I think that would be a very bad thing.
I just want to add on what you were saying, that an example, I work with a patient organization, like I mentioned, here in Brussels, the 101 Genomes Foundation, which actually is trying to improve research in the Marfan syndrome that their child actually is affected by. And they were in the place, okay, they went to the doctor and they had to sign a consent form, and when they left the hospital, they no longer had the form with them. So they were totally lost in this entire system. And actually what happened is then, first of all, they discovered there was not enough research happening in relation to what their kid was, the actual disease the kid was suffering of. But also there was a very big problem in consenting. And so what they actually developed in the context of their foundation is a patient consent application, which is just on your phone, and you can track what's happening, and you can opt in, opt out like you want at any point in time, and it's totally legally signed, it's totally legally compliant. So I think this was a bit missing in the presentation of the keynote this morning, is that, okay, we have infrastructure, we have data and all this kind of stuff, but I was missing the patient consent in this entire discussion. And I think this thing can also be automatized, not maybe by AI, but this small foundation here in Brussels demonstrated that it's possible, easy to do, and it's totally legally compliant. So I think this is something that needs to be incorporated there, especially if this data is going to travel wherever in the world and people are going to apply for using your data for some reason. You would like to know, okay, what's happening with my data?
Yeah, you
I
agree.
was just wondering, can we make it cross-border? I mean, these registers of consent or opt-out.
So they getting patients from the US even. So I mean, people just fill in this consent form, and then they get a kit for taking the saliva. This is sent to Ghent to sequence, and then they store everything themselves in their own biobank and in their own data hub, and everything is in order. They're actually the first data altruist organization in Europe, I think. So you should check them out.
Okay, I would like to also ask Audrey to respond. We heard two things actually. So we heard consent. I think that was also a point you would like to pick up on. But also these experts committees that Ildiko was suggesting. Do you feel that as your ethical manager that you should be taking up this role, or should this be something? No, I just proposing the possibility here, because you actually do have knowledge on what human oversight should mean in this context.
Yeah, well, while you were talking about that point, I was thinking actually about if we make ethics committees use AI in a way that it should at least be somebody that understands AI and what is happening on the efficiency gain and what it is doing in the back office of the committee. But then you have also the ethics committee itself, which has been the same composition for 30 years, 50 years actually, even before the legislation. There's nobody that knows anything about AI or data use, or coincidentally. There's doctors, nurses, patient representatives, a legal, an ethicist, but nobody. So maybe there we should also add profiles that understand what is happening, that can explain what is happening, at least. And as for the consenting, what I wanted to mention is that indeed, again, you've touched upon a very important point, efficiency gain. It's all the time efficiency gain, but it's also in the practice of healthcare. You just mentioned they went in and then they signed something and they came out and what have we signed, and what we see consent forms all the time of 40 pages on average, and let's say that 5 to 7 pages of that is about data use. So that's one thing. But on the other hand, for registers, as it is not research yet, it has no specific research question, it's a technical distinction, but they don't need an ICF. They could use another legitimate basis and say you have an opt-out. And when we as an ethics committee say, no, you have only one inclusion a day or a week, you could easily explain to these people what is happening. They say, we don't have time, we only have 15 minutes for our healthcare, and then if I still have to explain everything, and also, yeah, consent, no, we prefer to use the opt-out and we'll give some leaflets. So it's actually fighting reality of time constraints in healthcare also. And it's maybe me being skeptical, but I really don't think patients are in control of their data. I don't.
Martina?
Yeah, just had a small point again on that point of the efficiency. So before I worked in England at NHS, and obviously we need to do spending reviews and budgets towards the Treasury, so the Ministry of Finance. And there was always, well, there's the aspect of productivity, but then also of this efficiency. But really the question is, indeed, if we do achieve this efficiency, they always ask, okay, so what are you using that time regained for? So that's also a question for all of us. Are we just using it to churn more applications? Are we now telling these people, okay, now with your expertise, whether that's appropriate or not, use that for that human on the loop, for that oversight, and does that balance out? Or are we effectively then releasing the time of those people, those experts, to really help where it's necessary? So the efficiency, where does that go? So in a resource-constrained world, where we have the pressures from ministries and others, we need to also think about that. So.
Yeah, I would say quality above quantity here, but yeah.
Yes, yeah. I was actually the first question came from the discussion that we had in January. I think we were at the Health Data Agency Symposium, and I think you, Audrey, mentioned how many actually ethical reviews you did a year. And imagine that the EHDS is opening up a lot of possibilities for people to request data from different purposes, 17 categories of health data. So we expect a huge increase in this. So we hope that we find a way to address this, to address the quantity and keep then the quality. Yeah, that is the difficult balance that we need to strike. maybe then we already slightly touched upon this tension between Europe and national and the national level. So should AI tools that we maybe then going to use in the decision-making support of the Health Data Access Body be developed or maybe governed at EU level to really focus on this interoperability that was mentioned this morning, and to ensure consistency in the European health data space? Or should a member state just retain the flexibility to develop their own systems? As because this topic is, of course, quite a sensitive one and could also be quite linked into how a health system is set up, culturally, traditionally, etc. And yeah, I think this question can be directed to a lot of the people here in the panel. Maybe first from a more practical perspective, Justin, do you have contact with other health data access bodies on this topic? And how do you organize yourselves?
Yeah, on that topic particularly, not really for AI for access applications, but we do for other purposes like having natural language search on the data catalogs, for example. So there is a question of like many countries or health data access bodies just basically reinventing the wheel. I think for applications, because there will be some national specific context that needs to be taken into account for each HDAB. Here at the Health Data Access Body, HDA, sorry, Health Data Agency, we will work with the Information Security Committee, which requires some information, right? But I think the question maybe could be, if we take a step back, because we talk about using large language models for like ethical checks or legal checks, but these models, they do not behave all the same, and these models, they are often also not European, right? So there is also a strong question of which model are you going to use, and on that topic, I think it would be really interesting to have something. There is Mistral by the French. That's something kind of like the core of the solution, maybe governed or at least, yeah, developed, co-developed on a European level. Now, I think really with the application of that technology, it becomes a bit tricky when you need to differentiate between these different national specificities, but still, application can also stem from a European level through the Health Data at EU platform. So they will be facing the same issue as we are, although they are not really assessing, but kind of splitting the access application and then splitting it across member states. But there will be a Health Data Access Body on European level for European data, so we'll see what they think.
Yes, we are very interested, of course, in how this will the EU will organize this on their level as an example, just to see how they deal with these issues. I see that Tom would like to come in here.
Yeah, just I want to continue on what you were saying, is that this is something that people in the AI community have been arguing for the last decade, more or less, is that we need, with all these advancements, not rely purely on the privately owned models that are being provided outside of Europe, just to put some markers on them. And we've been arguing for actually thinking about a CERN for AI, in the sense of that actually you need indeed large investments in a centralized point where we have our own language model development that actually takes into account in a correct manner how data can be processed, which data can be used to train this model, this kind of stuff. Because even in the case of Mistral, it's a private company, it's not something which is belonging to the public. Right? And so I think in that sense, it would be very good to have a counterweight there for actually having a public institution like we have CERN that actually is making these language models for the European community. I know there are some people already arguing about that. I'm not sure how much it is advanced, but actually they're looking into this kind of things.
And what do you think, sorry, but I was very, very interesting. What do you think about this? Is it achievable? Because member states have so many languages. So do we have language models? Do we need language models per member state or per language group? Or? So
this is the fun part for research, right? But also keep in mind, what are these systems training on? They're training on predicting the missing word or predicting the next word. So essentially these are why do they need such vast quantities of data? It's because you need to do this for a lot of data before you really get the performance that you see in the current type of models. So GPT-1 was not able to make correct phrases. I mean, GPT-2 only started making these kind of things. So really, I think we have a large body of texts, even just in Europe, to correctly process our own kind of language models. And if you look at the advancement of technology, these things are getting better and better and better in extracting and predicting this kind of thing. So essentially, I mean, I think the scaling question is over. Everybody was claiming we just make bigger and bigger models and they're going to be smarter, smarter, and smarter. This is done. Forget about that. There's a cap now. So we can do that, and we're definitely not too late to start doing that, but we just have to do this in a centralized manner and not one in Belgium or one in Netherlands or one in France. No, it has to be like a collective endeavor, in my opinion.
Yeah, apart from the technical issues, I would support that because when I did my research on ethics committees and what comments they give in Belgium, I saw that even within Belgium, there are very different interpretations of legal texts. So an access request or a patient would be more protected or get another protection if the application goes to this ethics committee compared to another one. So, of course, people are human and an ethics appreciation will always be different. But legal, this can be, and guidelines, this can be rather black-white. So it's more towards harmonization. So I would, for instance, at the Belgian level, it would be an advancement, but also at the European level, when we talk at the MedEthics EU, which is the ethics committees in Europe that come together with the Commission. There's also a lot of different interpretations within the EU, which is actually allowed by the legislation because there are a lot of implementing national provisions that can be. So I think that yes, please, but will be a lot of work.
Yeah. Just to come back on what you're saying here, this is very interesting. One of the tracks I'm working on is called collective intelligence, and we can actually demonstrate that if you just do your decision making based on a language model, you get like a good prediction, but you always get the same kind of prediction. Whereas if you combine the decisions or the choices made by people, you get actually better prediction. And if you combine both, you get even better predictions. Right? So essentially, it's not a bad thing that there is no homogeneity between the ethical committees. It would be even nice to have like 3 ethical committees looking at the same file and combining their advice in a predictive manner to actually get a better decision.
Yep. Yeah, so thank you for this decision. So maybe I also saw that Justin would like to come in, but maybe first a question to Edigo. What does the patient rely on? The EU, or would like your country to get the job done?
This is a very good question, because indeed there are some cultural differences, but that regards really the ethical assessment. What do we find okay? You know, what type of research, etc. But for this AI-supported workflow of giving permit, I think it should be on an EU level. I mean, the rights of the patients are at the EU level. We should also put the safeguards around these AI agents or whatever at the EU level. Otherwise, you will get probably a messy world around it.
Thank you for the clear answer. Then, Justin, you wanted to come in as well? No? Okay, because I think then we need to move to the part where we involve you. You have been listening already for 1.5 hours to several people making their points on stage, but what is your opinion? And I would like to give the floor to Milana, who will guide you through the Q&A, and I will be walking around if the tech allows me to do so.
Thank you very much. I see already some eager people. So 2 questions, one in the 2nd row and then later in the 4th row.
Okay, feel free to introduce yourself before posing your question.
Thank you very much. This is Xiao from EURTC. I have several questions, but I will try to keep it short. So the first one is about malicious application. So we talk about a lot of AI use in the process of the issuing permit process, but we don't really talk about application itself. So what we have already seen is that an AI making data subject request. So would you expect the same thing to happen to the data access application? And if so, do you think AI can prevent it or identify it? And second question about AI is, if any AI is used in this permit issuing process, can applicants opt out? I have another question for patient control. We talk about opt-out, and I'm just wondering how many granularity we have there. I'm just having some crazy thoughts, like can patients opt in for just federated learning, or say a data access request, or can they only choose to opt out for data access application? And what are your thoughts on synthetic data? So let's say the patient does not want to agree that my data will be shared. Can they still opt in for their data to be trained to generate synthetic data which can stay in the data pool, but of course marked as synthetic data?
These are some very, very great questions. Who would like to start?
I think I was directed for the first question. So yes, this will happen. I mean, people are lazy by nature. I mean, if you need like a lot of data from different origins, and you have now all this agentic AI technology that actually is going to do all this processing for you yourself, why not tell your agent, like, okay, I need to do research on this and this topic, collect for me all the data so I can start next week. So this is going to happen. I mean, will the system that has to verify if this is an agent, yes or no, understand that this is an agent? I'm sure that the one filling in the form will learn not to use M dashes because otherwise he's going to be spotted as an agent. So, I mean, this is going to be like an arms race, more or less. And the question becomes, where you really want to make it a race, or how do you want to do this? In my opinion, if people start using this kind of automated systems, it means there's something wrong with the application procedure, because they think it takes too much time. So they're going to activate this kind of automatic systems to actually try to get access to the data. And then you mentioned something about malicious stuff also. I mean, this is going to be there too. So you're going to you need security checks because, I mean, in the context of the ethical committee, they need to check, okay, is the data going to be misused somehow? Or can we assess this in some way? What's going on? So automatizing all these different steps is going to lead to deceptive behavior, dishonesty. I mean, these are topics of research in AI, how to block this kind of thing. So this is actively done, but I would not be surprised that this happens. I mean, yeah, but I think Julien also wants to say something.
Yes, maybe first to answer the first part. So when you want to send your application, you first have to log in, right? And you have to log in through high level of security if you follow the HDABs regulation, right? In Belgium, we have It's Me. I guess everybody is familiar with that. So it's already a security so that you're not able to just spam the system. And then also in the application form, there is a part about payment details. So this is up to national implementation, but you can start charging fees from the moment the application is sent, right? So again, it's up to national implementation, because you might say that for some bodies, there's no fee to send an application and to process an application. But if there is a fee and you start spamming, you'll have a naughty bill and we can track you back. Now on the question of opt-out, maybe first on synthetic data, I think it's really interesting. I'm involved in several projects like the SHAPED project, where we are studying how you can use synthetic data in the EHDS lifecycle. So synthetic data, but like really proxy data. So how can you use mock-up data? So, you know, you take the data set variables and you just say, just vibe some rows for me, please. That does not hold any statistical interest. That maybe could still be used like on the catalog as a way for the user to have a better vision on, okay, what is the data? Because we have a lot of information through the dataset descriptions, but then we need to use it to facilitate discovery. Now, for synthetic data, It is also heavily discussed how you can use it, and also the sensitivity of synthetic data. Is it still personal data or not? And it's not all black and white, just like anonymity. But maybe on the opt-out, because you also mentioned, can I just say that my data can be used for generating synthetic data? Well, opt-out is also up to national implementation, right? You can implement it however you want. You can do a binary system where it's either you opt out from everything or you opt out from nothing. But you are free on a member state level to also kind of decide of the granularity. Do you want to opt out by type of data? If you look at the minimum categories of health data from the EHDS, do you want to opt out by type of researcher? I will only allow my data to be used for public research, or it's up to national competency. I think in Belgium, because it's on my to-do list for next year, so we'll have more information next year. But this is discussed with other, like the Cabinet of Health, Ministry of Health in Belgium. So we'll see, because on one end, you want to give freedom of, like, liberty of choice to the citizen, but we also have a responsibility to make the opt-out like a clear procedure, not something where you have to have like 10 choices different. There are ways of still providing a bit of granularity, but up to member state competency.
I think Audrey wanted to follow up, and Ildiko as well.
If you were going on the opt-out, do that first.
Yeah, just to add our experience from the Netherlands, we did the research on this topic. What would people like? Really a black and white, I'm in or I'm opting out, or some kind of granularity. And what we have seen, and they want to have choices. They want to have choices considering the type of data. So just a few, for example, mental health data are a very sensitive group of data, and the whole genome. So not genetic data, not data like this and this genetic variants you have. No, but the whole genome sequences. That's important. And also what, according to the type of organization that will reuse it, for profit or non-profit, is something that they want to have a choice in. And of course the purpose: new medication, for cancer research, for policy purposes, etc. But we think, because there is no decision yet from the Ministry of Health in the Netherlands about this, we hope there will be some choices, probably not so much as we would like, but they have to make, there is also a balance between, research purposes, to be able to do good research. It's just, I think, and I'm looking at my neighbor, I think it's important not to have too much choices. So there we should hit a balance there.
Yeah, I want to come back to the application and the application form, because we've been saying filled in by AI or assisted by AI and whatnot, but I wanted to point out that the application form, on the one hand, would provide information, as it is now for us, for an ethics committee to review and assess. But the other intent of an application form, at least as how we view it, is to make the submitter already reflect on what he is asking. And filling it in by AI totally passes by this purpose. So maybe we should re-look the questions that are asked in an application process. And I know that this is also a problem at exams for professors, that you can find questions that are not easily filled in by AI. But maybe we should, what do we want to achieve with an application process? An overload of information, because AI will give you a lot of very deep reflections, but actually we want to ask a question: do you need all of this data? Do you, where is it? Are there other possibilities, and so on? And now we are really not getting there. The application processes, I know, for ethics committees at least.
Justina.
Yeah, I guess I just want to make a note between this and what we were mentioning on mock data, because I think that's where it can, or well, federated analysis. Or, for instance, in the UK, there's Open Safely, where you can, at arm's length, query EHR system, this for primary care. And indeed, it follows the Open EHR model, but so it first provides you this mock data, which means, this means that the applicant, obviously that's more on the technical side, but still he needs to think of how he's structuring his research, needs to look at the data, needs to look at the methodology, can make sure that what he's submitting will also, you know, can get some advice on that. And I think that's also a mechanism to say, okay, do a bit more of the homework and ensure that what you fill in is good, as opposed to just sending. Now, of course, there's also Cloud Code and others that then could do that, but still, it's an extra layer of due diligence that I think the researchers are willing to put in. That could partly answer that, I think.
I have so many follow-up questions, but for the sake of time, I think we can move to the next audience question.
Thank you. So I'm Sarah Roda from Standing Committee of European Doctors. My question was a little bit to follow up on what Audrey was mentioning about. Because if we have an AI application, then it would be a process validated by AI, probably an assessment by AI. Martina mentioned, and then my question is how to ensure that this will be done in real practice. So we will have, you mentioned the KPIs. Probably KPIs will be done by a report, then the report is done by the AI. So how to ensure that everything, this exists actually and it's useful. And then for the other part was, again, a little bit about the learning process. So one of the things when PhD researchers do to present an application, this is part of the learning process, frustration, creativity, and so on. And so aren't we also a little bit jeopardizing that and to leave perhaps not for early researchers to do this kind of automation use of AI and leave it for later. So it was a little bit of a reflection and question.
Thank you. Before moving to the answers, is there anyone else who would like, okay, there is another person in the back, and if we manage, we'll do also your question too. Please, who would like to go?
Yeah, so yeah, I think the question of when you start automating things and basically you have just machines talking with machines is an interesting topic. I have a friend who is really an AI doomer and he thinks we are heading towards the WALL-E situation, you know, so just on a spaceship and just in floating chairs. But I think it's also a double-edged sword. Both can play this game. So if as a researcher or user I use AI to have this very polished application and I don't fully read whatever it vibed for that, and then I realize that it puts some conditions for data access that completely messes up with my research, it can also be a problem, you know, on both sides. I think it's the point I was trying to emphasize a bit early on is that if we just end up with like passive approval of machine outputs, we're all going to get bored with it pretty quickly. So I hope that in fear of being too bored, we'll think about systems where you can actually have a real collaboration between an AI system and a human, not just approval.
If I may add, I think in this process, so not to end up in this new reality of AI for AI, we really need to co-design together with all kinds of experts, or not only technical people, with all the respect, but if you leave technical people to design a system, they will forget things, you know, they have a kind of tunnel vision. So you need their scientists, sociologists, behavioral scientists, etc., ethicists, patients, citizens. So that's, I think it's very important to do it right, because this is now the moment we are shaping this system. And indeed, I also think what Audrey told, why are we doing this? We want knowledge, we want solid scientific knowledge to be able to build upon new innovations, but also new treatments. And if we, you know, let it loose and create a world in which we have AI writing an application, sending it to the HDAB, assessing it partly, then the researcher will take it out of the secure processing environment. The results, it will help. AI will write the paper, will review the paper. I mean, what are we doing then?
But this is exactly what's happening. I mean, you have an entire field called AI in science, and essentially they want to automatize the scientific process. Again, for reasons of efficiency, because suddenly I can check not only 2 hypotheses, I can check 100 hypotheses. And then they hope to produce research in that sense. So for me as a researcher, I say, no way I'm gonna do that. I mean, it's the pleasure of doing the research and actually to come up with the answers by whatever tools I can use, but not just to produce more. For instance, I also draw. The final picture is not the goal of the drawing, it's the drawing itself that is the goal of being an artist. And so companies like OpenAI and Google don't understand it's not about the end product, it's about the process. And it's the same for research. But in the end, what you see, there's a huge activity in automatizing science. Yeah. I mean, they're building robots for doing for molecule testing and compound testing and whatever you want. The entire team can be in a loop, and once in a while, you need a scientist to actually check what's going on. But for that,
very briefly,
yeah,
and then we can move to the next question.
Yeah, I completely agree. I used to be myself a scientist, and it was very interesting what Ninka said at the very beginning. So I wrote it like legally sound applications, etc., are needed, but scientifically sound. And it struck me because I think that is also part of the health data access body tasks, isn't it? You have to have some kind of hypothesis, and then we go, of course, if we would have time to elaborate on that, this paradigm shift of driven by a scientific hypothesis or data-driven science, which is, I think there is also tension in there.
But maybe just a very small comment. Yeah, I was for the question. Sorry, very small comment. It has been tried before with IBM Watson. IBM Watson was the system that was going to cure cancer. We no longer need doctors to do that. They're going to do this purely based on existing data. I think it started, and after 2 years, it silently died. So the same thing is going to happen with what we see now, in my opinion.
Thank you. Has the person already the microphone? Yes, Sarah?
Hello, everybody. I'm Sarah, and I'm from the European Association of Urology. Really interesting discussions. I'm just wondering about, can AI be used to track, because we've got the data users are going to be making the requests in the first place, really interesting discussions about that, but then they've got some obligations about the 18-month publicly available results on those data that they've reviewed. Can AI be used to track that research question, the data that they accessed, and then the results, to see whether we've got the right system in place, whether we're to help us identify whether they've accessed the right data for the results that they've published on the system 18 months later? Are you already thinking about that?
Thank you, Sarah. Maybe if there are any other questions, we are going to the coffee break after this, and then we'll also have the lunch break. So if there are any questions that are left, our speakers, I think, will remain for some time with us. Who would like to respond first?
I can respond. So you're asking, can AI be used for the process of tracking the research, right? Because you start from your hypothesis, you go to the data you need, and then you produce results, and then they're stored for a certain amount of time. So essentially, any publication of quality requires that you deposit your data that is linked to the publication you actually did, right? So
I think data users have to make their results available in 18 months of the request, right? Under EHDS, I think.
Yeah, but even for an academic, if you publish your research, the data that actually is linked to the research needs to be provided in a repository for the publication in order for other people to verify that what you did is correct, that you did not screw up your statistics or all this kind of thing. So I don't see why we need AI for that. I mean, there are processes in place. In human sciences, I also do behavioral economics research. We need to upload our hypothesis to an online server. And it's actually mandatory more or less nowadays. If you want to publish your paper, you need to mention that you pre-registered your hypothesis and your process so they can verify that what you published actually makes sense in function of what you hypothesized before. So there are a lot of, in academia at least, a lot of steps there already that are considering these kind of things. Yeah.
I think, but maybe just knows, but I think it's 18 months from when the research finishes, right? As opposed to from the first application. So it could be a few years after that we're talking about, but maybe just take it broader. I think we first need to really sit and think of this evaluation framework. Even if we just go back to the first preambles that we put in the regulation, like that's where it comes to, are we reaping the benefits? Are there more startups, more innovations? Has it led to discovery of new drugs? Not just these KPIs, as I said, of output, okay, how many publications, what's the impact factor? But so, and that is something we'll need to do continuously to see how is the system working and where are the fail points. Now, I do agree that the bit about publishing the outputs is very important. I'd even go further and say I'd like that all, there's also IP concerns and so, but that all the code that is used is maximally made available. So again, that the next researcher that comes that doesn't need to re-cleanse the data in a slightly different form or need to go into a paper and see in the methodology, well, how did they exactly define diabetes type 2? Did they include the use of insulin or just the flag of the ICD-10 code? So as much as possible, we should make the outputs available. We should cross-check with what was put in the initial and see that it helps others so that as we go, we improve the system and that we can see it materially.
Yeah, I would like to give just now the final word because we need to close the discussion. I'm very sorry.
I'm honored, thank you. Yeah, maybe to jump back on that topic, indeed, it's 18 months after the permit ends that you need to publish the results. You need to publish the results, but the Health Data Access Body, as far as I know, doesn't have to check really the results, like check that it was a proper usage of the data. I think these assessments already take place when you provide the data permit, when you do the ingress and egress out of the secure processing environment. If we need to do another check once the results are published, I think it's really a nightmare. But I might be wrong. I will double check to make sure. And I wanted to add something also on, I forgot now.
Well, we still have
Yes.
we are the first panel, so we still have the whole day to debate. I would like to leave you with some takeaway messages. Of course, it's impossible to summarize this whole 90-minute discussion, but just a few points. I think AI as a supporting tool for decision making should not replace decision making. AI can help the health data access bodies manage scale, manage the complexity, but should remain supportive. Check the flags. I've noted down. Also, the responsible AI begins with the careful task selection. I would like to focus on this as well, because the user journey consists of more steps than just permit decision, and we also heard that upstream, but then now also in this final question, downstream, there are some points where AI could assist optimizing the European health data space. Milana.
Well, something that all speakers brought up, and this is the human oversight, and that at a certain point there will be a human, or should be a human. So I would say one of the messages for me is that human oversight must be deliberately designed, not simply assumed. And also another thing that we touched upon several times, which is trust. And it's also a topic very close to, I guess, all of us. And it's that it will be a determining factor for successful AI integration. Governance and transparency, fairness, accountability should not be optional features, but they are preconditions for legitimate governance in the European health data space.
Yeah, and with this, I would like to thank the organization for giving us the opportunity to organize the panel, the panelists, my co-host for this lively discussion, and a question for the audience. Imagine a moment 7 years from now. You are at the office of a Health Data Access Body. It's Friday. And then, to discuss over lunch, what does your successful and trustworthy AI-supported data permit system look like? So, can you start the weekend? Thank you very much.
Thank you.